Hi, Ross again. Just a quick update really on the scaphoid ligament injury I had. Obviously, it's actually day 4 now. So it's 4 days since the op. I haven't been on for a couple of days because I've had a few problems with the wrist, etc., and just trying to get it working again. But today's been good. Day 2, once the nerve block started wearing off through the night, day 2 morning was very uncomfortable, intense pain. I called the doctor and he told me to come in straight away. I explained it was like a crushing sensation, and he ended up taking my cast off, and as soon as the cast came off, I felt 100 times better. I think the problem being was the cast was too tight, and possibly the swelling didn't help, and it was sort of digging into the pins and the nerves and the cuts, so it wasn't very nice at all. I mean, the doctor done a great job with the surgery as far as I know, but I wouldn't say doctors are perfectionists when it comes to putting casts on, putting plasters on, etc. Obviously, the part of the hospital I went to the second time, they were obviously very experienced at doing this. So, yeah, and I was day 2 basically very, very sick. I had the morphine liquid solution, didn't really agree with me, with the codeine as well and the ibuprofen. I'm literally sick all day. So I've changed my medication now to tramadol, which I take with ibuprofen, and it seems to be working. But today's day 4. I've decided today, as you can probably see, I've kept my arm in the sling. I think the last 2 days, having it hanging out and walking around and trying to do little bits and bobs like cooking and stuff, it's just too much, too soon after the injury. So I've been sensible today. I've had a pretty quiet day, keeping it in the sling, as you can see there. I move my fingers pretty well now. The thumb, however, is probably, it's very numb still. It's probably 50-50, but I've been told if it's not white, there's no problems. Yeah, I certainly recommend keeping your arm in a sling. But yeah, it's feeling good. At night time, occasionally, especially yesterday when it wasn't in the sling, I think it started swelling up again. I took another ibuprofen last night, rested it on a pillow, fell asleep with it on the pillow, and it wasn't an issue. But at times it can sort of swell up and hurt a bit as well. Occasionally, 4, 5, 6 times a day, if I do move the wrist slightly wrong, or the cast digs in a bit, I'll get a sharp shooting pain. It actually feels like an electric shock in the hand. But I think that's just part and parcel of the whole operation, really. But I'm feeling very confident today. I was lucky enough to see the extent of what scars I'm going to have when I got the second plaster on. And there seemed to be about 4 or 5 cuts. It didn't seem too bad. One at the top, it's hard to show you here. One obviously at the top of the wrist, one at the bottom of the wrist, a couple at the sides, I know that. So yeah, I can actually feel my wrist, and I can feel where the pins are. Obviously the pins are connecting the bones. As the doctor stated, my ligament was totally gone. It was, he's had to totally rebuild that. And obviously he's had to drill holes into my bones, which he struggled with to put the pins in. So yeah, I think as long as you keep on top of the tablets, every 4 hours I've been taking them. I know it says 5, but I like to keep on top. I think everything's going quite well considering it's day 4. But obviously the first couple of days was a bit of a shock. I'll try and keep you guys updated. The reason I'm doing these videos is myself felt very nervous, anxious about the whole operation beforehand, and actually it hasn't been as bad as I thought. Obviously early days again, but I just want to reassure people who are having any doubts, etc. You know, it's something you need doing because arthritis will kick in. So I'll try and keep you updated as much as possible. I'll probably leave it a few days now. Try and keep busy, I suppose. I fixed a fuse before, it took nearly 1 hour for a 5-minute job, but that's life, hey ho. Any queries, just obviously send a question. I'll answer as soon as I can. But I'll keep you guys updated. Thanks for watching. Bye.